All right, today we're going to be medical detectives. We're going to investigate some pretty mysterious and, let's be honest, kind of alarming clues the body can send out. And what we find out together, it could be critically important. Okay, so picture this. You see something like that. It's pretty alarming, right? It's like your body is sending you this super cryptic message. But what in the world is it trying to tell you? Because, this one single clue, it's often the very first sign that something pretty serious is going on inside. So every good investigation starts with the first clues, right? So let's dig into these strange warning signs. Think of them as the body's first alarms, telling us, hey, the case is officially open. Okay, so our first major clue actually has a name. It's called melena. And that dark, kind of tarry look, well, that happens because blood is being digested as it moves through your system. So that color change isn't random at all. It's a direct signal that there's bleeding happening somewhere inside. And here's our second big clue. It's called hematemesis, which is a technical way of saying vomiting blood. Now, this can show up in two very different ways, and each one tells a different part of the story. If it's bright red, that points to fresh, active bleeding happening right now. But if it looks more like coffee grounds, what does that mean? Well, it means the blood has been sitting in the stomach for a bit, and the stomach acid has already started to break it down. So, besides those two really obvious clues, the body's going to send out other signals too. You can think of them as side effects of losing blood internally. So you might feel this burning pain in your upper stomach, maybe some dizziness, or just feeling really weak. Your body's also trying to compensate for that blood loss, right? And that can lead to tachycardia, which is just a fast heart rate, and hypotension, which means low blood pressure. Okay, so we've gathered all the external clues. Now it's time to take our investigation to the scene of the crime, right inside the stomach. This is where the real action is happening. And here we have it, the official name for what's going on, a gastric bleed. So what is that exactly? Well, it happens when ulcers, which are basically sores, start to eat away at the stomach's protective lining. And if they dig deep enough to hit a blood vessel, well, that's when the bleeding starts. A good way to think about it is like a pothole forming on a road. First, a tiny little ulcer, a sore, starts to form. Then, over time, it just keeps eroding deeper and deeper into the stomach wall until, bam, it hits a blood vessel. And that's the moment the internal bleeding starts, causing all those signs we just talked about. Okay, so if these ulcers are the problem, then what's causing the ulcers to begin with? It's a great question. Let's go ahead and line up the usual suspects. Yeah, so it turns out we can trace most of these ulcers back to three main culprits. First up, there's a bacterial infection called H. pylori. The second big one is using NSAIDs a lot. That stands for non-steroidal anti-inflammatory drugs, like ibuprofen. And third, though it's less common, severe physical stress on the body can actually cause what's called a stress-related injury to the stomach lining. All right, so we know the crime, the gastric bleed, and we've identified the main suspects, what's causing the ulcers. Now we can go back to those original clues we found and look at them with an expert's eye. Let's decode what these signs really tell a doctor, because each one is a really, really vital piece of the puzzle. See, this is how a doctor deciphers those clues to figure out how serious things are. Melena, those dark stools, that usually suggest the bleeding is a bit slower, and it's coming from higher up in the GI tract. That coffee ground look, that often means the bleeding has slowed down or even stopped. But massive, bright red hematemesis, whoa. That is the loudest alarm bell. It screams active arterial bleeding, and it's incredibly urgent. So, we've gone through the clues, the cause, the culprits, the whole shebang. So, what's the bottom line here? What's the single most important thing you need to take away from all this? Here it is. This is the sentence that ties our whole investigation together. Gastric bleeds often result from ulcers eating away at the stomach lining, and they make themselves known through melena or hematemesis. It really is often that straightforward. So now you can recognize the signs, but what's the real takeaway? We've decoded all the clues, and we get the danger now. But the most important lesson isn't just knowing what these things mean. It's about understanding the urgency behind them. Recognizing a sign isn't the end of the story. It's the critical first step you have to take to get help.